Thank you, Mr. Chairman. Good afternoon, gentlemen. Would like to kind of continue on the line of questioning that Representative Carroll was into with the exchanges and all. And we do recognize the choice that needed to be made by the administration, obviously with your input into it. I'm wondering, the word exchange, I guess now, is HHS is giving a directive they'd prefer the word marketplace. Right. That's what I'm hearing at this point. How much of a marketplace are we really going to have? I've also heard that the baseline coverage level will be Aetna 3.4, I guess.
Their point of service plan, correct.
Correct. And so, you know, I'm reminded, you know, back in the day when cars were new as a concept and Henry Ford basically told people you can have your Ford any color you want as long as it's black. You know, is that what we're in for here? I mean, you can have your plan any way you want as long as it's Aetna 3.4 and that's kind of it?
No, I mean, to be fair to the Affordable Care Act, you know, it does envision different levels of plans, different types of plans. They've used the you know, sort of the metal terminology, bronze, silver, gold level, where, you know, the further you go up, the more benefits and coverages, the less in terms of co-pays that you will pay. So there will be diversity both in terms of product as well as cost. What the Aetna product you mentioned has been identified by HHS as sort of the baseline essential health benefit baseline for Pennsylvania, on which all of these plans and products will be built. So there will be diversity, but it will be, you know, along the lines established by the Affordable Care Act. You know, it does set very clearly in the law what has to be in each product. It sets in the law very clearly the rating methodology that has to be used. So in that respect, there's not going to be a lot of change, but I think how they're packaged, how they're put together, you know, you will see some distinction. And I think it will be interesting to see over the next few years really how companies try to diversify themselves, given that they're held to very similar product and rating standards, how they will differentiate their products versus somebody else. Is it going to be on quality? Is it going to be on service? So, you know, it will be a very unique market experience over the next few years. And we're already talking with companies, and the expectation is we will literally get hundreds, if not thousands, of filings over the next few months for us to approve that will ultimately populate the exchange.
And any estimate of numbers of carriers that we're talking about here?
Randy, I don't know if you have exact numbers.
Well, it would be just a shot in the dark if I gave a number right now. You know, we have 9 major health insurance companies in Pennsylvania, and we have dozens, up to, I believe, over 80 other insurance companies that offer comprehensive health insurance. Whether they all will play in the exchange, I don't know. I've had one company tell me they're not going to play in the exchange out of all those that I mentioned. I think there's still more detail that needs to come out before companies can make a decision. But the 9 major players, they're not only in Pennsylvania, but in order for them to succeed, they're marketing in many states, and I expect to see those 9 major players. And they're the household names that I don't want to mention here, but you know who they are.
Very good. And then a budgetary question. I understand that there was an $11 million drawdown for design of the state exchange, which we did access, but we will keep some of that and return some of it back to the federal government?
We applied for a $33 million level 1 exchange implementation grant at the time. You know, we were considering all options, including a state exchange. We never tapped into those funds as a state. Those funds were never drawn down upon. They were made available to us. We have recently gone back for a request for $11 million of that 33 to be used by the state to help offset costs associated with the federal exchange. We have made that request, but as of this date, we have not heard back from CMS or HHS on whether they will grant that request. So at this point, with regard to those funds, we have not accessed, nor do we have possession of any of them.
And final question, if I may. I recognize, the state versus federally designed exchanges, Medicaid expansion. And these issues remain open to some degree, but what's the next big issue that will face us as policymakers in the Commonwealth and the administration?
I think, we will continue to have opportunities, and this was, something that the governor has made very clear, to innovate in our own marketplace. The Affordable Care Act certainly is a centerpiece of health care going forward, but it doesn't necessarily have to be the end-all, be-all, and there are still opportunities for states to continue to find ways to innovate in their marketplace and really try to address, for example, affordability, which continues to be a major concern for the governor and for us. Accessibility is great, but if you have a product that is accessible but not affordable, it's really not much good to consumers. So I think one of the things that we will be looking at as an administration and as a Commonwealth is really, are there ways we can make health care more affordable as well as accessible?
Very good. Thank you. Thank you, Mr. Chairman.